talk about multiple sclerosis. So multiple sclerosis is a disease which is an autoimmune disease which affects the young people, usually 20 to 40-year age group. So it affects the brain and the spinal cord. So patient gets attacks due to immune dysregulation. Sometimes they get inflammation in one part of the brain or the spinal cord or the eye nerve or the optic nerve. So they can come with sudden onset of blindness of one eye or sudden speech problem or paralysis or unsteadiness of gait, ataxia. So any of these symptoms may be the first sign of multiple sclerosis. Usually this multiple sclerosis we diagnose by doing an MRI, a good quality MRI scan of the brain. We have to use some specific protocols to pick up this disease. And we also do other investigations like blood investigation to rule out other condition which can be like multiple sclerosis. We also do a CSF analysis, that's spinal fluid testing. Based on this, a diagnosis is made. But why do we develop this multiple sclerosis? As I told you, it is an autoimmune disease. So mainly it is because of many places earlier this disease frequency was very high in polar regions like the North America, Northern Europe, Australia, because the sun exposure is less. So wherever sun exposure is more, the disease is less. One of the reasons is the absence of vitamin D, that is vitamin D deficiency. This also causes this disease. So once we diagnose this disease, we have to find out how active is the disease. For some people it may be very mild disease, some it may be a very active disease. So the treatment is tailored according to that. So a good hospital should have a good team of doctors, like say an Apollo hospital, where you have all the facilities, the 360-degree facilities to make the diagnosis. Once we make the diagnosis, we can give, nowadays highly active treatment are there. So when we give those drugs, we can prevent long-term disability and we can also prevent further attacks so that patient can lead a healthy life.